So we were talking earlier about having to disinfect a lot of parts to our ambulance and doing all those things, but one of the things that we have learned in a process that we're going through is trying to reduce our risk of exposure. And reducing our exposure comes in a whole facet of things. Now, let's face it, it starts from the dispatch. The dispatch center is key to this process. As always, the call starts there, right? They call 911 and are requesting an ambulance. The dispatch center is asking all the right questions. They're going to ask the questions that would tell us whether or not we should be suspect of a COVID patient. But in general, what does the dispatch center do? It prepares us for the call. They start our assessment. They do the things that we need to do on our way to the call. They tell us where we're going, what type of resources we might potentially need. And typically we show up on scene, 2 or 3 folks, all grab all kinds of gear and go running inside the residence. Well, during this particular pandemic, that would not be the most appropriate thing to do. Several reasons. We're exposing ourselves and everything that we have to that patient if in fact they are a positive COVID patient. If they are a positive COVID patient, why did they call? We may be able to do basic support things to transport them to the hospital and reduce the exposure to ourselves and to the equipment. So one of the things we do is we send only one individual in initially to do the assessment. We like to call it the 6-foot assessment. They are going to be using their mask and their goggles, but they should be able to do a quick assessment based on that information that they have. And now we need to get intimate with the patient, right? So we're going to need to get our basic set of vitals. So inside of that one particular organization who's got the resources, they have a blood pressure cuff, a stethoscope, and a disposable thermometer that they put in a Ziploc bag, and one person goes in and exposes themselves to the patient. Okay, so they go up and get intimate with the patient. They get the blood pressure, they get their temperature, they get their pulse rate, and of course their basic vitals of respirations, etc., etc. Here we don't have the disposable thermometers. We have a handheld ones that we don't have to touch them, and they very quickly will tell us what our temperature is. This particular product, again, we can disinfect, keep it clean, keep it in a bag, and keep it safe and disinfect it. It's really small and it works. Do we need all these other things? Well, it depends on the call. If we have a critical call where the patient is in respiratory distress or respiratory arrest or cardiac arrest, or we've got a traumatic situation where we have life threats in our BLS assessment, we need this stuff and we're going to use it, okay? But if we don't, why would we want to bring, our airway bag or perhaps our Lucas and our med bag in? We don't need those products. We can do the cares we need to do and get the patient safely to the hospital. Secondly, we don't want to necessarily be doing advanced cares in the confined area of the box. In order to reduce exposure, one of the things we do is if we have to nebulize, for example, we're going to keep them in a more open area. The other thing that we're going to do is, I'm going to go backwards a little bit. Dispatch center is going to do their best to try to get those patients to move into a more open area inside the house. Why would 3 firemen and 2 paramedics walk into a bathroom and try to do an assessment on a patient? Why would we do that? It doesn't make any sense during this particular time to crowd in there. All right, so let's get them out into a more open area. Why do we need that many folks in there? We don't right now, unless it's a critical patient. So what we're doing is reducing our risk by reducing the amount of people being potentially exposed. And that's kind of one of the processes that we're trying to use. So with that said, we don't necessarily need the big bag. We don't necessarily need the Lucas device or anything like that unless we gotta have it. So let's take that into consideration as we look at how we're treating our patients and what we're doing. I am in no way telling you to not treat your patients. It's very important that we treat our patients. We treat them appropriately, okay? We treat them appropriately with our support and with ventilations if we need to. So from one end to the other, emotional support to ventilatory support, we're still going to do the things we need to do. Let's just be cognitive of what we need to do and then expose only what we need to expose. The dispatch center is also doing a great job of allowing us the time and opportunity. It's a pandemic. We have to understand we have time. We have to take our time to save ourselves, because if we expose and end up going out in a 14-day quarantine, we aren't helping our fellow man. That's why this is so important that we follow the PPE guidelines that CDC has set. Follow them through. Those are the things that are going to keep you safe. Get a mask on that patient as soon as you possibly can. If that first person comes in the room, hand them a mask. Hand them that simple mask and get that on them. You've now eliminated a vast majority of the potential droplets that might make you sick. Okay? And then, of course, with your PPE, you've got double the protection. That in itself is going to be enough to keep you safe. We're going to stay at the low risk level. Okay? So, all that being said, I could talk about this for a couple of hours if you want, but we're just trying to get some quick messages out. And by all means, follow through with the CDC guidelines. If I said it once, I'll say it 1,000 times. Facebook is great for jokes, but the CDC white papers, the Department of Health, that's where your real information is. So go out and find that information and be educated. Knowledge is key. Be educated.